My special guest this week on Nutrition Science Bites is Allison Roberts. Welcome, Allison.
Thank you, Claire.
Yeah. And Allison, I would say it's not common to wear two hats. And the two hats you wear, of course, are a credentialed diabetes educator as well as an accredited practicing dietitian. And, you know, you must have so much experience, particularly given that you work both for the health service and also in private practice. So thank you for sharing all of your expertise today. We're really going to try and get to the nitty gritty of blood glucose monitoring.
Thank you. Thank you for having me.
So, can we start by I think everyone's heard of blood sugar or blood glucose, but sometimes I think it's really good to go over the basics. So, exactly what is blood sugar and what are people talking about when they talk about blood sugars and diabetes?
Yeah, so the sugar in our bloodstream that we call glucose, it gets there from the carbohydrates from our diet. The way that our body digests carbohydrate into its simplest form, which is glucose, where it then enters the bloodstream, where it waits to be used by all the cells for fuel.
Yeah, so essentially it's basically fuel for the car. So, what is the big deal then with blood sugar or blood glucose to be specific? What's the big deal about that with diabetes? Why do we focus and talk about that so much?
So we all need sugar and glucose for our cells to use as energy. But when we have diabetes, what that means is that our body is no longer able to regulate the sugar in our bloodstream as well as what it used to. And therefore, our blood sugar levels become high. Over time, high blood sugars can cause damage to our organs and can make us quite unwell.
Yeah, that's really it in a nutshell, isn't it? And my understanding is that there's a difference then between like the types of diabetes. I think as you get older, you certainly hear lots of people who have type 2 diabetes, but I think it's not uncommon to know a family where they've got a child with diabetes or people requiring insulin. But is it as simple as that, that children are more likely to have type 1 diabetes and then having insulin injections, and adults are more likely to have the type 2 diabetes and they don't have to have insulin injections? Is it as clear cut as that?
No, it's not as clear cut as that. There are lots of different types of diabetes, and the most commonly known diabetes is what we like to call type 1 and type 2. They are very different, but these days we are seeing a lot of crossover with people developing type 1 diabetes later in life. Not
Ah.
just children and adolescents, but we can see people of all ages developing type 1 diabetes. And type 2 diabetes, which typically does happen later in life, but we do see it occurring a lot earlier in young people as well.
Well, that's it. That's
There's
important to
other
know,
forms of
isn't it?
diabetes as well.
We don't need to go into those because I think it's probably going to get really complicated. But if if someone has type 2 diabetes, is it possible that they could also need to have insulin injections?
Yeah, they can. So, typically in the early stages of type 2 diabetes, it progresses quite slowly compared to type 1, and people respond a lot better to lifestyle changes and oral medications that we have available. But over time, the disease can progress and they can become more insulin deficient. When people have had type 2 diabetes for a long time, they may need insulin to manage the diabetes.
Because it's that insulin, isn't it, that's kind of like the vehicle for getting that rising blood sugar out of the blood and into those cells that you talked about, including the muscle cells. So in the very basic sense, I know the science is quite complicated, but the basic sense, type 2 diabetes is, and you said in like an insulin deficiency, but you're producing some, whereas type 1, like definitely not enough to cover your needs.
Yeah, that's correct. So with type 1 diabetes, often they become quite insulin deficient early on, and their body is relying on the insulin that they're injecting to manage the blood sugars. With type 2 diabetes, it is driven by what we call insulin resistance, which means that the pancreas is still producing insulin, but that hormone insulin just doesn't work well.
Right. Okay, that makes sense. So now that we've sort of painted that picture of those just the two major types of diabetes, I can really see how the focus is all then on the blood sugar. And you said when your blood sugar's high, that's when that level in your blood is actually damaging organs and things in your body. So if that is such a really big deal for measuring your blood sugar, how do you do it? Like, what are the different ways? Because again, you see people walking around with the white dots on the back of their arm now for monitoring their blood sugars. But my strongest memory is like my mum had type 2 diabetes and she had the little machine and the strips and doing the finger prick test. So what's the key difference about these sort of things, and why do people have to do that for a start?
Yeah. So, finger prick testing is when we have a needle or a lancet that pricks the fingertip, draws a little bit of blood, and we put that drop of blood on a strip that's connected to a glucose meter. That glucose meter then reads the sugar level and shows us a number, which is a reading that is what the amount of sugar is in that sample of blood at that time. The continuous glucose monitoring systems, or CGMs, they are different because they will monitor the blood sugars continuously over time. So a CGM basically has a small filament or a sensor that sits under the skin, and it's continuously monitoring the blood sugars every minute, and it's sending that information via Bluetooth to either a transmitter, or sorry, a receiver, or an app that the person has on their phone. So with those continuous readings, we actually get a bit more of the big picture in the sense that those readings are plotted on a line graph, and we can look at that line graph and produce some information that tells us the percentage of time that the blood sugars have been in a safe range, and to also look for trends in terms of what their blood sugars are doing over certain periods of time and what the trends are with their blood sugar readings.
So that's a massive, massive difference then, isn't it? So with the finger prick, people they're only going to get the information about their blood sugar at that very one point in time. And I'm going to ask you about like when do you have to measure it versus that sounds to me like you're getting a huge, huge amount of information. So I've got two questions like,
Yeah.
why doesn't everybody have one of those things? And, like that must hurt when you prick your finger, but does that hurt? Now you've got essentially like a needle in your arm constantly. So trying to help drill down on the advantages and disadvantages of both of these different types of monitoring systems for blood sugar. So with the finger prick first, like now you're only measuring it half a dozen times a day.
Yeah, that's correct. So depending on what's been recommended to them by the person by their healthcare professional, they may just be wanting them to check their blood sugars maybe just once a day, just to get an idea of what's happening first thing in the morning. But to get a bit more of an in-depth picture of what's happening with their blood sugars, it's actually more beneficial to be monitoring the blood sugars several times a day, either before a meal or 2 hours after the meal. This can be done in lots of different ways. So for some people, they might just choose a couple of days where they very intensely check their blood sugars before and 2 hours after their main meals. They do that for a week. They get a good picture of what's happening over the week, and then they might have a rest. For other people, that may not be practical. So what they might prefer to do is just pick a time, a couple of moments over the day before or after a meal, and test it at those couple of times, 2 or 3 times a day. over a few weeks to provide the information that we need to look at what's happening with the trends of their blood sugars.
And you
With the
said,
CGMs,
oh, Alison, can I jump in and just ask you a question? Because you said a couple of times then that the key times they might be asked were before a meal and then the 2 hours after a meal. So why is that? Why are they like the key times if you're doing the finger prick testing?
yeah. So when we check it before a meal, it reflects what the blood sugars are doing in what we call a fasting state when we haven't eaten for a while. We do expect that the blood sugars will rise after a meal. The extent of that rise can often help to determine whether that meal was appropriate for them and whether particular medications are working well for them. So we have different targets that we have for the blood sugars before the meal or in a fasting state and roughly 2 hours after the meal.
So now I'm going to ask you then, what is that sort of target range for anybody who's listening, who is doing finger prick testing? They might go, oh, gee, they might be sitting there thinking, gee, I hope I'm remembering the right targets or aiming for the right target. So I think it's worth mentioning those. And am I right in thinking that the 2 hours after the meal, is that is that when the digestion of the carbohydrate and the conversion into the blood sugar and it gets absorbed? Is that when it should have already peaked, or is that like around the peak?
Look, it can be around the peak, and that's what we're looking for. It actually really depends on the type of food as to whether the peak of the blood sugar will happen earlier than 2 hours, and sometimes it can happen later than 2 hours as well. But roughly at that 2 hour window, that's when we'll see the peak glucose coming from that meal.
Right. And so what's the glucose level target before the meal then? And then that whenever time slot people are doing it after a meal, trying to get the peak?
Yeah, so before the meal, we're aiming for 6 or below, and after the meal, we're aiming for about 8 and below. Those targets can vary depending on the individual, but generally speaking, for someone with good diabetes control, or if we're looking for someone that doesn't have diabetes, we would expect the fasting readings to be under about 6 and the 2 hour reading to be under about 8.
So, Alison, it seems to me then that part of what happens, and again, like correct me if this isn't exactly right, but when someone gets referred to you for improving their blood sugar levels, it's probably quite likely that they're not at those targets, and then you would be working with them to make changes in their dietary patterns or physical activity patterns, whatever, to help them learn about how to get into those targets to improve their blood sugars, to improve their long-term health. Have I got it?
Yes, correct. Correct. So after we monitor the blood sugars before and 2 hours after the meals, it's really helpful to actually look at those meals that they're choosing. And they very quickly learn what meals are actually giving them quite good numbers and keeping their blood sugars in a safe range, and what meals are pushing their blood sugars well above those targets.
Well, that sounds like really empowering to actually learn that, and a really good strategy. So if you're going to do that, then would you normally also be getting someone to like be writing down what food they're having while they're doing the finger pricks, especially if this is the first time they've ever been getting advice from a dietitian or a diabetes educator?
Yeah, correct. We do ask them to keep a food diary and record their meals and their portions along with the blood sugars. And it's a great learning activity for them to identify those meals that are working well for them and the meals that perhaps aren't working well for them.
Yeah. Can I just ask you a question? Like, over all your years of experience, when you work with people to do that, are there any sort of key things where, people commonly go like, aha, I get this is what puts my blood sugars up, or I can see that by tweaking this. Are there any like really standout things that you actually wish everybody knew already?
Yeah, absolutely. Um, I think when people first start to do it, we can always read the information and hear about what foods aren't good for us, but it isn't until they actually see in real time for them what is working for them and what's not. Um, I very commonly see people, having things like, iced coffees, for example, or some very heavily breakfast cereals where perhaps the marketing around those foods for them over the years has convinced them that they're not too bad or that they're actually okay for them. But it's not until they start looking at their blood sugars closely and seeing that effect that they're having that those foods are having on the blood sugars that it can be quite an eye opener for them.
Yeah. So would you say then that it actually leads to some food changes more commonly, or is it more commonly around portion sizes?
I think a combination of both. Um, both the food choices and the portions, I think. It can help them understand the effects of both of those.
Okay. And then I cut you off earlier when you were going to tell me about the continuous glucose monitoring again. So if you've got a continuous glucose monitor, would you would you typically also be keeping a food diary at the same time?
We do ask them to if they're coming to see me for some diabetes education or some dietetics. I do ask them to keep a food diary for a couple of days. It doesn't have to be the whole time that they're monitoring their blood sugars or wearing the CGMs, but we do ask them to keep a record just for a couple of days, days that they're not necessarily changing or modifying their diet, but just eating normally, and that can be really helpful.
Yeah, that makes sense to me. Like if you're investing the time in wearing a continuous glucose monitor, then to get more out of that opportunity, then keeping the food record as well is actually really going to tune you in, I imagine, to that, relationship between your blood sugar and your food. Can I just check though, um, so when you do your finger prick, that's in your blood, but you said this one was just the continuous glucose monitor. Mostly I see people wear them on their arms. That's actually under the skin, is it? So is there a difference in how accurate those two different measures are?
The CGMs, the continuous glucose monitors, are measuring the amount of sugar in the interstitial glucose, which is the fluid that just sits around the cells. There is a little bit of a lag time between the capillary, the finger prick, and the tissue glucose that the CGM is monitoring. There's a little bit of a lag time, but over time, these CGM systems have become a lot more accurate, a lot
Right.
more reflective, and we're starting to see a lot less variability in the CGM readings compared to the finger prick readings.
Yeah. And can I ask you then, I'm the sort of person who loves information and data. So I would love a CGM, but I can imagine with some people that go, oh no, that's a little bit of information overload. So, and also modern technology, are they expensive? So I want to know about the cost of each, because that might influence whether someone says, oh no, I'm going to do finger prick or I'm going to do CGM. And yeah, and that sort of technology. So is one more expensive than the other?
Yeah, absolutely. The capillary glucose meters are certainly cheaper. It's a cheaper option for people monitoring their blood sugars. Typically, a finger prick glucose meter will cost around $20 to $50 from your local
Oh,
pharmacy.
that's
For
pretty cheap.
people with diabetes, though, they yeah, so for people with diabetes, they do get subsidies through the National Diabetes Service Scheme, the NDSS. So they do get those meters subsidised through NDSS, and they also get the strips that go along with them subsidised. So that subsidy is there for people with both type 1 and type 2 diabetes. With the continuous glucose monitors, they're a little bit different and they can be quite expensive. So the different CGMs that we do have available here in Australia can range anywhere from $65 up to about $375
Wow.
for a period of time. So some of the sensors will only last 7 days. Some of the sensors can last 10 or up to 15 days. So it does depend on the sensor that they choose to use, how long they get wear out of it, and the cost as well. Again, people with type 1 diabetes do get a subsidy for the CGMs through NDSS. They just have to pay a co-payment to NDSS, which works out to be about $30 a month. For people with type 2 diabetes, there is no subsidy available at the moment through NDSS, which means they do have to pay out of pocket, which means it can be a much more expensive tool to use without that subsidy.
Yeah, that sounds like there's the line in the sand for a lot of people.
Oh.
Or that if somebody with type 2 diabetes was wanting to use it, it might be something, would I be right in thinking you might just use it one off or very occasionally? And also that's a big difference in the range of them from 65 to $300 for one CGM if you don't have type 1 diabetes, if you have type 2 diabetes. That's a big range. It sounds like you'd really want to shop around then
Yes.
too. And
Yeah,
if
yes,
people
that's
wanting to shop
correct. Yeah.
around, can they get more advice through NDSS on CGMs or Diabetes Australia, perhaps?
Yeah, we do. Look, we would encourage people to consider the CGMs that are available in Australia that are supported by NDSS. I guess that is where there is a little bit of a concern around people being scammed online for products that claim to be CGMs, but don't necessarily have the right technology. So we have seen people in clinic come in where they've purchased a watch, for example, that's claimed to be able to monitor their blood sugars, but unfortunately,
Oh,
without that finger prick or that
yeah,
access to the glucose, sorry, the blood sugar, they're not accurate. So
they've been
I would,
scammed.
yes, yes, that's
So it
right.
sounds like people could definitely check in with NDSS or Diabetes Australia on those. And actually, we can put links in the show notes to those. So one of the other things then, Alison, that I wanted to ask you then about, so I think that kind of makes sense to people that food would clearly affect your blood sugar levels, and knowing more about food is going to help you with reaching those targets. And it's probably most commonly that for people with type 2 diabetes, they're doing the finger prick test. So it's going to be before and after meal targets. But is there anything else that affects those blood sugar readings that it's really good idea to be aware of?
Yes, absolutely. So I guess the main macronutrient that we know impacts blood sugars is the carbohydrate. And we've talked about how the quantity and the quality of that carbohydrate will affect the blood sugars. But there's other influence on the blood sugars that comes from protein, fat, and fiber as well. So when you have a very balanced meal that is high in protein and high in fiber, it might have some healthy fats in there as well. Those other components of the meal can actually slow down the digestion and helps to reduce how quickly that carbohydrate component of the meal gets converted into glucose. So we always recommend choosing your low GI carbohydrates, whole grains, legumes, fruits, dairy foods, um, as well as pairing those carbohydrates with protein, fat, and fiber as well.
So can I just give an example for the listeners? So am I right? Like, let's say I'm going to have a sandwich. I'm going to have two slices of bread.
Mhm,
So if I have whole
mhm.
grain bread, I have a slice of cheese, got my protein, and then I put a heap of salad on there. If I have that, then I might see like a pretty even rise. 2 hours, I'm going to be back in the blood sugars. But if I have a jam sandwich on white bread, and I've got no protein, then at 2 hours, maybe my blood sugar is still, outside of that range.
Yes, absolutely. That is correct. Yeah.
Because sometimes I think it's hard for people to know what those healthier carbohydrates or lower glycemic index carbohydrates. So it's choosing the ones that are more grainy or chewy, rather than things that are, you know, Sometimes I think of them as the fairy floss carbohydrates. And honestly, I reckon there's some breads that may as well be fairy floss. They kind of, you don't even have to chew. It's like they evaporate, in your mouth. And then you're going, oh, I'm still hungry. I'm going to have another one of those bread rolls. But then I've had two. Okay, so now I want to ask you about like what about stress? Does stress push your blood sugar up? Because lots of people have worries these days, and particularly with the financial crisis. So, what role is stress in terms of what if someone's feels they've got their diet managed pretty well? What other things might be at play in terms of raising their blood
Mm.
sugars?
Yes, many things, and stress can certainly play a role with the blood sugars. Stress hormones, cortisol and adrenaline, can cause the body to become a bit more resistant to insulin, and it can
Oh,
cause the blood sugars to rise. Other things like quality of sleep and sleep patterns, again, because of the changes that we see in hormonal profiles, they can affect the blood sugars. So, a lot of people who sleep poorly or have undiagnosed or untreated sleep apnea, we can often see waking up with higher blood sugars because of the changes in their hormones overnight. Another big factor is, of course, physical activity. So, when we're active, that hormone insulin works really well and can really help our body to uptake that glucose out of the cells. Muscle movement also helps to burn glucose, so that always helps. We always see exercise having a very positive effect on blood sugars. Depending on the type and the intensity of exercise, you can see improvements with the blood sugars for up to 24 hours after that
wow.
movement.
Wow. I'll have to tell you a story, Alison. I mentioned that my mum had type 2 diabetes, and I was at it for ages. Ask your doctor to let you get a glucometer. Anyway, eventually she got the glucometer and she rang me up and she said, guess what? When my blood sugar's high, if I walk up and down the back stairs 3 times, and she had 17 stairs, she said, it goes back into the normal range. I remember saying, that's wonderful, Mum. I was so happy for her that she worked out a way of bringing her blood sugars back down. And it was really, really empowering. So I guess that's why I'm always in favor of people learning more about their own blood sugars and what their ways that help them manage their diabetes. Can I just do a little clarification here, though, because I imagine this exercise effect is quite different depending, whether you're like my mum and you're 70 or 80, or whether you're like a teenager doing sport where the difference in physical activity, it's not walking up and down the back stairs like my mum. It's playing a game of sport or swimming or something like that. So what are the extra nuances around that physical activity and your blood sugar readings then? Like if it's a kid doing sport, would you have to be more careful about that? What if you do too much exercise?
Yeah, absolutely. So it is really important for very active children, athletes, people that do big, heavy workouts with diabetes, to obviously monitor the blood sugars quite closely to make sure that their blood sugars don't drop too low. I always like to tell everyone that any amount of exercise can have a positive impact on the blood sugars. We know that even 10 or 15 minutes of walking can actually drop the blood sugars quite a lot in some people. So, when you're doing quite intense exercise or when you're exercising over very long periods of time, we can obviously see much more dramatic, significant impacts on the blood sugars changing. And for that reason, it does need to be managed quite well, in the sense of making sure that that person has been having regular meals and that their blood sugars are monitored during that activity to make sure it doesn't drop too low, particularly when people are on insulin.
And how much is too low? Like you told us those pre-meal targets, the post-meal target. What's that kind of exercising target?
We don't have a particular target for exercising, but we don't want the blood sugars to drop under 4. So hypoglycemia is when the blood sugars drop under 4 millimoles, and it's often paired with symptoms. So once the blood sugars drop that low, it's quite common for people to feel quite sweaty or shaky. They might get some blurred vision. Everyone's a little bit different, and it can become quite dangerous to that person if the blood sugars aren't brought back up.
And can I just clarify then for type 1 and type 2 diabetes, am I right in thinking that with type 1, you really will need to eat something because your body can't do much to help you out, so to speak. But with type 2, because you've still got those hormones working a bit better, you're not likely to have that hypo. Can you just clarify that in case people are going, "Oh, I better check," but they're lesser at risk for a hypo?
Yes, that's correct. So many of the medications that we use for type 2 diabetes don't necessarily put people at a risk of severe hypoglycemia. There are two types of medication, diabetic medications, that we know will always work to drop the blood sugars and
Yeah.
therefore do pose a risk of hypoglycemia. And they are sulfonylureas, a particular tablet that we use in type 2 diabetes, and insulin, which is what we use in both type 1 and type 2.
Okay,
So
so
for someone with type 2 diabetes, if they're on neither of those medications, then they may have a lower risk of having a hypo. But for people on insulin or on a sulfonylurea, there is a more significant risk of hypoglycemia.
okay, I'm gonna ask you what the common sulfonylureas are, but that's really important then for people to know then, like if they're not on insulin, but they're on medications, then they could check that with their healthcare provider, whether it's their doctor, their pharmacist, their diabetes educator, or their dietitian. So what are those
Yeah,
common
absolutely. So,
sulfonylureas then?
yeah, so they're typically called diamicron or glycoside. And it would just be a simple question to their doctor to ask whether they're at risk of having hypoglycemia, particularly if they're planning on changing their lifestyle. So, if they're planning on starting to do a bit more exercise or make changes to the diet, they may just want to ask their doctor, are these tablets I'm on going to put me at risk of having a hypo?
And then the last thing I wanted to ask you, Alison, is there any special sort of care or precautions that people need to take when they're monitoring their blood glucose? You know, like that blood glucose monitors that have to get serviced, cleaned in a special way. Do you have to be, and then for the CGM, do you have to be especially careful because like you can be in the supermarket and see someone who's got one in their arm. Oh, I remember the British Prime Minister. You used to see hers in the back of her arm.
Yeah, absolutely. So with the CGMs, there is a risk that you might accidentally knock it off. So we typically wear them on the back of the arm, although there are a few that can also be worn on the leg or the abdomen. So things to be mindful of is try not to knock it off, particularly if you've paid a lot of money for it. It's
Yeah.
quite valuable. But they are approved for swimming. So most of them you can still go swimming with, you can shower. Do need to be taken off before certain scans like MRIs or CT scans. So that will be a question that is often asked these days when you go in for a scan or an x-ray if you're wearing any of these devices. With a glucose, a finger prick monitor, a capillary monitor, um, nothing in particular that people need to be worried about or aware of. Generally speaking, it's just a very superficial pinprick. So the risk of infection is quite low. Obviously, if they've been out for the day, we always recommend washing the hands quite well, making sure that they're nice and dry, avoiding too much moisturizers or alcohol wipe on their hands at the time that they're doing a test, and making sure that they haven't recently prepared food because we don't want any carbohydrate residue left on their finger
Oh,
before
right.
they do that finger prick test.
Oh, okay. Yeah, of course. Now, when you say that, that kind of makes sense. So, finally, is there anything else that you think that people need to know about blood sugar monitoring?
Look, I think it's an excellent tool for people to be able to really monitor their diabetes or their blood sugars themselves, and to learn how the choices they're making with their lifestyle, with their food choices, exercise, sleep patterns, how all those things are actually impacting their specific blood sugars. I think with CGMs, one thing to always keep in mind is that it is a lot of information that you receive. For some people, that can actually be quite overwhelming.
Mm.
And it's not unusual to see patients come in after they've worn one. It's always positive feedback in the sense that they've found it really informative. But sometimes it can be quite overwhelming, and particularly if they're seeing high numbers and they don't necessarily have a plan of what to do. I see people coming in and they're trying to work out exactly what happened on this day when their blood sugar went up to 12. Most of the time, we can pinpoint what it was, with perhaps something that they ate or something that they did on that day, but not always. And I think it's always important to remember that we don't want to get too fixated on just one individual reading. What we're doing with these numbers is actually trying to look at the bigger picture, looking at the trends over a couple of days rather than just what's happening at one time, at one moment.
Yeah, and the whole purpose is to try and improve people's overall health and well-being, isn't it? Yeah. So, Alison,
Absolutely.
how often would it be appropriate for someone, like to get back in touch with their diabetes educator and their diabetes dietitian to have a review?
Yeah, look, I encourage people to consider having those review follow-ups at least once every 12 months, just as a bit of a refresher, just to review what's happening at that time. We don't eat the same things every day, and our lifestyles change, our routines change, and often it's good just to have a bit of a check-in, just to review what's happening at that time, to monitor the blood sugars closely if they haven't been doing it for a while, and really get a feel of what's happening for them at that moment.
Okay. Well, that's a good segue, chatting then about food and if that's changed. Um, so you have shared a recipe with us, which we'll put on No Money, No Time and call after you. So, can you tell us what your recipe and why you picked that one?
Yeah, the recipe that I supplied is a Mexican styled stuffed capsicums. I really personally love Mexican food, and my husband loves this capsicum, so it's always a great way to
Yeah.
get a bit more veggies in. We usually like to just clean up whatever veggies are left in the fridge as well. So it's quite a versatile recipe that you can add different things to.
Yeah, that sounds really yum, and we'll get that on to No Money, No Time. And actually, capsicums are on special at the moment. I must admit, I always get excited when red capsicums in particular are a really good price. Well,
Yes.
Alison, you've shared heaps of really fabulous information with us today about blood sugar monitoring. So, Allison Roberts, credentialed diabetes educator and dietitian, thank you very much for being on Nutrition Science Bites.
Thank you so much, Claire. It's been a pleasure.